We're only halfway through the summer, but scientists are already seeing signs of a fall COVID wave.
Here in the United States, we are seeing a slight increase, both in terms of wastewater concentration levels, hospital admissions.
The latest Ontario data also shows a rise in positive tests since early July, with nearly 7% coming back positive by the end of the month. That uptick comes as this virus keeps evolving to sneak past our highly trained immune systems.
Variants are constantly changing. This is what the virus does to stay in business. It mutates and tries to find new customers.
New Canada-wide data provided to CBC News suggests an Omicron subvariant called EG.5 now makes up more than a third of all recent infections, mirroring the same trend south of the border.
Over the last year, we've been dealing with the Omicron family, so it's not a new variant of concern. It's certainly a new subvariant that we're keeping a close eye on.
The good news is vaccine manufacturers are finalizing updated booster shots for the fall COVID season, and they should cover this subvariant.
I do think that there is enough data showing that variant-specific boosters do have a pretty broad effect.
For most people, that protection should keep you out of hospital, though it won't always keep you from getting reinfected.
Definitely monitor your symptoms closely.
This pharmacist says if you're high risk, it's worth asking about Paxlovid, while others can usually manage symptoms with over-the-counter medications.
If it's something that's more like a dry cough, you can take a dry cough medication. If more congestion is your symptom, there are medications to treat the symptoms rather than treating the actual condition. And that's kind of the same thing with flu or a lot of other viruses.
So, Lauren, some solid advice in that clip just there. But after years of this, is there really anything new we should be considering?
There is. First, the tried and true protective steps. You can consider wearing a mask during cold and flu and COVID season. Definitely stay home from work or school if you're feeling sick. But in terms of what's new, I would say it's about evaluating your own personal risk and how that changes over time. You could become immunocompromised. You could need an organ transplant. You could become pregnant or have a major health issue. And of course, everybody ages. So you can become higher risk. The thing you can do is get a booster shot. They will be updated this fall with strains that are currently circulating. So that is one smart way to protect yourself as your own risk changes over time.
Always good advice. Lauren, thank you.
Thank you.